Thank you. Thank you all for coming today. This is an exciting day for the Research Institute. This is an exciting day because we've been waiting 3 years so I can actually tell you where the Research Institute is headed. We have a lot of things to do, and we're going to do them. We have some goals for the next 20 years. 20 years is a long time, and a lot can happen in 20 years. But for transplant, a lot needs to happen, and we need to get some things done that can really help transplant patients. So in your handouts that we gave you, the little brochures, it kind of gave you some stats about transplant. 33,000 transplants were done last year, but unfortunately, a lot more patients are still waiting for organ transplants. Over 100,000 patients still need an organ transplant. Worse yet, 20 people die each day waiting for an organ transplant. And so in my mind, this is unacceptable. We need to change this. Doing a transplant is a gift of life, and it saves lives, but it doesn't last forever. Kidneys and livers and pancreases last 10 to 15 years, while lungs and intestinal transplants have very poor outcomes and on average only last 5 years. This too is not acceptable. So how are we going to change this? And how are we going to do this at the Terasaki Research Institute? Well, it starts with our mission. So our mission at the Terasaki Research Institute is to solve the biggest problems in transplant and to achieve the ultimate success of organ transplantation. Our two top priorities that we're looking at is to solve the problem of the shortage of organ donors and stop people from waiting and dying on the organ transplant list. Our second is to put an end to an organ transplant failure. And this is something that Dr. Terasaki focused on for many years of his career. And again, we're going to do this within the next 20 years. It really all starts with our passionate team. And we have a great set of researchers here and team members that make this research possible. And so I really thank them for all their efforts because this couldn't be done without them. We're doing lots of different things than even we've done in the past. We have data science, transplant education is led by Dr. Waterman. We're looking at new clinical trial endpoints with the FDA, and we're doing a whole host of these. These will change over time because what we'll learn will help the transplant patients over time, and we'll need to adjust and make things better faster. But we can't do this alone, so we need collaborators, and we have lots of collaborators out there. We work with lots of individual transplant centers, and here's just a short list of individual transplant centers that we're working with already today, and we have been working with for a long time. We also just worked on setting up the first clinical trial consortium in transplant, first long-term clinical trial consortium in transplant, and it's only freestanding. It takes up about 10% of the annual U.S. kidney transplants and 20% of the U.S. pancreas transplants. So within this, we'll have a great understanding, and we'll be able to do clinical trials much easier in transplant. On top of that, we took over the International Intestinal Transplant Registry. We're running this for all intestinal transplant across the world. And so we'll be able to work with these centers to improve intestinal transplant, a place where we need a lot of help. And we can't do this without the support of pharmaceutical companies. So we're working closely with pharmaceutical companies, helping use their data, helping make things more move forward in this field, helping with new endpoints so that they can get drugs approved. A lot needs to be done. The Terasaki Research Institute, we will collaborate and innovate to solve the biggest problems in transplant. And this is something that is the legacy of the Institute. This is a very early picture of Dr. Terasaki. Dr. Terasaki was one of the best collaborators he's probably had in the early years, Tom Starzl, who just passed away recently. And collaboration is where it starts. Innovation comes from the collaborations, and I think we can succeed as a Terasaki Research Institute doing this. So with that, I want to thank you.